For over 35 years, Susan G. Komen has been waging a war against breast cancer. We've pushed breast cancer out of the shadows and started a national conversation. We've funded nearly $3 billion in research and community health programs. There are now more than 3.5 million breast cancer survivors in the United States. But there's more to the story. Our fight is not over. It has only begun. This year alone, over 260,000 people in the U.S. will be diagnosed with breast cancer. An estimated 154,000 people are living with incurable metastatic breast cancer in the U.S. That's 154,000 people who are dealing with constant doctor's appointments, endless rounds of treatment, and daily fear of knowing that one day, breast cancer will kill them. That's unacceptable. Over 40,000 people still die from breast cancer each year in the U.S. 40,000 people dead each year. That's unacceptable. It's unacceptable that African American women in the U.S. die from breast cancer nearly 42% more than Caucasian women. 42%. That's due to a range of possible factors, such as education, culture, healthcare access, and even where you live. That's unacceptable. Breast cancer is the leading cause of cancer deaths for all Hispanic women. That's unacceptable. Nearly 28 million people are uninsured or underinsured, and every day, people are forced to skip or forego treatment due to the lack of financial resources. That's unacceptable. Breast cancer is unacceptable. That's why Komen is here. It's why we've built the largest grassroots network to provide screening, diagnosis, treatment, patient navigation, and education programs to those who need it most. It's why we're determined to make sure where someone lives doesn't determine whether they live or die. It's why we fund nearly 300 teams in 32 states and 11 countries who are at work to find cures for breast cancer so the next generation doesn't have to wait for one. It's why we've significantly increased our research funding devoted to metastatic breast cancer, and it's why we take a multifaceted approach towards fighting breast cancer. Research, support, public policy, education. Breast cancer is unacceptable. As long as 40,000 people die, as long as one person dies, our fight is not over. We're determined to reduce breast cancer deaths in the U.S. by half, and we're going to do it by 2026. We can't accomplish this alone. We need you to join this fight. The fight to ensure we're the first generation to see the last of breast cancer. Failure is unacceptable.